My name is Brian Blank, and I am a family medicine doctor. I started a business called Ember Modern Medicine, which is a private, direct primary care medical practice. So direct primary care is it's a newish model of doing primary care medicine where instead of billing insurance, we usually do some sort of monthly membership. And in exchange for that, we end up having longer visits. So at our practice, we have hour-long visits, and we tell patients that we can see them the same day or the next day if they get sick. So we spend more time really kind of diving into somebody's sort of experience and what they're going through, and really trying to think through the problems, whatever it is. And so it's a style of practice that's been around for maybe 10 to 15 years or so, but really in the last 5 years, I think we're seeing these types of practices pop up more and more. The goal we really have is, our monthly membership, ideally less than the cost of a cell phone bill. In our practice, we try to include just about everything as part of that. So there's no extra cost for labs, like blood work for the most part is all included in that. If somebody fell and needed stitches, urgent care type stuff, we can take care of. Strep tests, flu tests. It's remarkable when you get into it to see the markups that go into very common things like, say, a strep test or a flu test or basic blood work. When it gets done, insurance adds these markups. And so when we sort of decouple ourselves from the insurance system, it really opens up the possibilities for this style of practice. I am a career changer. I was originally a journalist before I kind of got this bug to go into medicine. It was a long road, probably longer than I was expecting, sort of getting into it, but knew I wanted to do primary care. Was going through my medical training up in North Carolina, trying to figure out how to make that work. And I saw this type of practice up there, and I thought, this is exciting. Direct primary care, it seems like a way of making medicine work, if that makes sense. There's so much that's wrong with the current medical system right now, and it's leading to these poor experiences, I think, for patients, for doctors, and we get to eliminate a lot of that by having longer visits with this style. If you were to talk to doctors 20 or 30 years ago, most of them probably would go into some sort of private practice when they were done with their training, and that sort of be the general expectation. But these days, there's been this giant mind shift where now the expectation is to be an employee, when you graduate with your medical training. And there's very few doctors, I think, that want to open up their own practices now. They feel like they can't do it or they don't know. And I didn't have any experience either, but I'm figuring it out as we go, and it's been a really fun process. And I've had such a good experience that I mention it to my friends who are in medicine, and I suggest that they think about maybe becoming independent and getting away from the hospital systems and kind of doing their own thing.